Hi, I'm Jenny McAteer, a physical therapist with Resolve Physical Therapy. We're here today doing our first video of a series that we're going to call Wednesday Wisdom, and our first guest is Dr. Jeremy, and I'm going to let him introduce himself.
Thanks, Jenny. My name is Jeremy Boethin. I own and operate Point Chiropractic, one of Resolve PT's strategic partners here in town. And I've been in practice since 2003. I've been in Bend since 2006. And we have an awesome family-style practice that takes care of little bitty babies and kids all the way up to Medicare-aged folks as well. So good family-style practice, and Resolve PT has been a good partner for us to help serve our patients at a higher level.
Awesome. And so we wanted to interview Jeremy today to give a little bit better background on what chiropractors do and get rid of some of the myths that are out there. So whenever we have patients ask about chiropractors, they always either love their chiropractor or they say, oh, they just crack backs. And so can you give us a little bit of insight on what chiropractor does for your overall health and wellness?
Sure. So chiropractic, gosh, this is a whole class here we can teach. Most people's concept of chiropractic centers around disorders of the musculoskeletal system, most specifically to the spine. So we're often thought of as doctors for neck pain, back pain, headaches, low back pain with sciatica. We also take care of lots of other joints, hips and knees and ankles. And kind of the cheesy joke in our office is if two bones come together, I can probably move it. And so that's a good segue into the adjustment. So the adjustment is what chiropractors do. So we take spinal bones or extremity bones, but mostly spinal bones that are misaligned. And so it's a relational phenomenon. So the spine loses its normal alignment through the accumulation of stress or trauma. For most of us, though, it's repetitive stress and trauma to the spine, microtrauma. And when those joints lose their alignment, they irritate surrounding tissue, which could be as severe as the spinal cord, spinal nerve roots. Obviously irritates muscles, tendons, and ligaments, and the adjustment takes the spinal bones from a position of misalignment, poor motion, and helps reestablish that normal motion, normal alignment. And then the healing begins because there's a pressure release off the nervous system. So it takes pressure off the nervous system, and kind of how I describe it to people is it reconnects your brain and your body, that electrical loop through the nervous system. It reconnects brain to body, and then it also reconnects that sensation where the body can then communicate better with the brain. And when that loop is closed, meaning we have good communication, we all heal differently. We all heal better because of that. So most people know, hey, it makes my neck feel better. Hey, it makes my back feel better, which is great. It's less drugs, less surgery. That's, when it's appropriate, that's a great thing. But when your body heals differently and your nervous system is better connected, that helps lots of things like immune function, digestive function. It affects your heart rate. We know it affects your respiratory rate. There's all kinds of physiologic markers that are better when your nervous system functions better because it's the master control system. So adjustment's good for pain, but it's also really good for stimulating the nervous system in a way that it functions more efficiently.
Perfect. That was one of the newest things I've learned about chiropractors in the last few years, so definitely what I wanted you to touch on. Another big thing that we get from all of our patients is that they're afraid to be adjusted, afraid to get their neck cracked.
Sure.
How does your office kind of deal with that?
Sure. So I would say it's one of the most common barriers to care for folks. I don't want Dr. So-and-so to twist my head, right? We hear that quite a bit. So we have a couple ways around that. My primary technique is done with the patient lying face down on the table. We utilize a drop table technique, which still allows for my hands to be on the patient, but we utilize their weight or their mass to create tension in the joints, and then my hands can release that, and as the table drops, the body follows, and that helps provide the adjustment. So it really kind of takes away some of that. And then I brought my adjusting instrument here that I use is a generic term for it is an adjusting instrument. There's a whole technique wrapped into that instrument called the activator technique. So for some folks that either they just don't want to be touched, that's the case with some folks. Little touching is possible. The instrument's great. Also for folks that just generally err on the side, their body needs less force than more force. The instrument's great for that. For some, it's great for conditions like Rheumatoid arthritis is great for osteopenia and osteoporosis. For some of the older population in our office, their bones aren't going to handle a lot of aggressive adjusting, so the instrument's great for that. It's also great for some folks that love the drop table, but when you get to their neck, they just prefer the least amount of force as possible. And so I can use that very, very gently, still achieve results without the anxiety and stress to the patient. So, and we can use it on jaws. I use it on extremities.
Say only on necks, or you can use
No,
it?
we can use it. It's applicable everywhere. Use it on hips.
Okay.
It's good on soft tissue too. Sometimes if I have really aggressive muscle spasm, I can use it on muscles to kind of calm them down as I'm working through and adjusting. It's a great all-around tool just to kind of take the ease out of it. And the adjustment itself is designed to take the body from a position of imbalance towards balance. So we're really trying to work with the body, trying to disrupt as little as possible. The adjustment really is just trying to relieve the imbalance so that the body's wisdom, the body's innate ability to heal and regulate itself takes over. We want to do that as efficiently as possible, so that the instrument and the drop table really help provide that for our folks.
Perfect. And then the big question, of course, tie it back in. How do you think chiropractors and physical therapy should work together?
It's a pretty simple referral for me, honestly.
Okay.
I have zero desire to be a physical therapist, so that's where it all starts for me. I'm a chiropractor. I want to be really good at adjusting. I want to be the best at that adjustment I can be. I want to be the best at it in the world, possibly, right?
Yeah.
Just develop my craft as much as I can. And I really, if I wanted to be a physical therapist, I would have gone to PT school.
Yeah.
So I don't need to be a physical therapist in my office. Do we give some exercises? Yes, very, very simple stuff. But I've found that you actually, when you go to the master, right? Jenny's devoted a lot of her time, energy, and resources in her life to become very good at this. So she's going to do a way better job than I am. So, and some things just lend themselves better. Like, will chiropractic help a rotator cuff disorder? Yeah, absolutely, because when the neck and upper back move better, it takes stress off the shoulder. Will it rehabilitate it fully? No. And I'm not going to spend the time and the energy and the resources, and I don't have as in-depth a training as you do. So that makes more sense to refer that out, right? Also, patients utilize us pre and post surgery. So if they have a hip replacement, a knee replacement, a shoulder replacement, a low back surgery, a neck surgery, there's re-education that has to happen because they're forever different after a surgical process. That would be a great referral. Motor vehicle accidents, when you have an injury like that, it needs to be rehabilitated. I'm not going to do that in my office, so that needs to be referred to a physical therapist. I mean, we should have a pretty easy referral partnership. Yeah, it should be like playing tennis.
Yeah.
Just kind of back and forth. So the trick is finding, obviously, like we all deal with, is trying to find a good one, right?
Yeah.
And so I'm glad we found you.
Yes, and also why we're interviewing you as one of our good chiropractors. I would say in a perfect dream world, it would be like get an adjustment from a chiropractor, come to PT, learn your exercises and your stretches, keep everything in that good alignment.
Supportive, yeah.
And even end with a massage or something.
There you go.
The soft tissue part, but
That would be great.
Awesome. Well, thank you for answering a few questions for us.
My pleasure.
Hopefully it helps you guys understand a little bit more about chiropractor care. If you have any questions, feel free to get a hold of either one of us. So Dr. Jeremy from Point Chiropractic and Jenny from Resolve Physical Therapy. Until next time.